friends, myself Dr. Love Krishna Pal Singh Rathod. Today we are discussing about the sebaceous cyst. What is sebaceous cyst? Sebaceous cysts are common non-cancerous cysts of the skin. Cysts are atypical growth in your body that may contain liquid or semi-liquid material. Sebaceous cysts are mostly found on your face, neck, back. They grow slowly and are not life-threatening, but they may become uncomfortable if they go unchecked. Sebaceous cyst is a term which was used in old days to denote presumably sebum containing cysts originating from sebaceous gland, but which were actually one of the following: epidermoid cyst, epidermal cyst, epithelial cyst, or infundibular cyst. These are intradermal or subcutaneous cyst. Pilar cyst, trichlemal cyst, isthmus categon cyst. These originate from sebaceous gland. Epidermoid cyst originate in the epidermis, and pilar cyst originate from hair follicle. A cyst that originates from sebaceous gland and contains sebum is quite rare, which cysts are called steatocystomas. The term sebaceous cyst therefore should be dropped, and epidermal cyst and pilar cyst should be used, but these terms along with sebaceous cyst are interchangeably used in practice. Causes: sebaceous glands are present in the skin. This gland secretes sebum which keeps the skin and oily. The duct of the sebaceous gland mainly opens into the hair follicle and rarely may open directly onto the skin. If the duct or the mouth of the sebaceous gland become blocked, this usually occurs due to trauma to this area. The gland becomes distended with its own secretion and forms a sebaceous cyst. So this is a retention cyst and is most accurately called epidermoid cyst, since such cyst is lined by superficial squamous cells. The trauma may be a scratch, a surgical wound, or a skin condition such as acne. Sebaceous cyst grows slowly, so the trauma may have occurred weeks or months before you notice the cyst. Other causes of sebaceous cyst may include deformed duct, damage to the cells during surgery, genetic conditions such as Gardner syndrome or basal cell nevus syndrome pathology. Such a cyst is lined by squamous epithelium and contains sebum, which is yellowish pultaceous material with unpleasant smell. Such material contains sebum, fat, and desquamated epithelial cells. It is turbid in nature. Clinical features of sebaceous cyst: it is a typical cystic swelling which is spherical in shape. Its size varies from a few millimeter to 5 centimeter in diameter. The surface is smooth and there is a bluish or blackish spot or punctum which indicate the blocked opening of the duct. The swelling is usually not tender. In case it is tender, the cyst is obviously infected. Small cysts are typically not painful. Large cysts can range from uncomfortable to considerably painful. Large cysts on the face and neck may cause pressure and pain. This type of cyst is typically filled with white flakes of keratin, which is also a key element that makes up your skin and nails. Most cysts are soft to the touch. A sebaceous cyst is considered atypical and possibly cancerous if it has the following characteristic: a diameter that is larger than 5 cm, a fast rate of recurrence after being removed, sign of infection such as redness, pain, or pus drainage. Common sites: a sebaceous cyst can be seen anywhere in the body, but most commonly seen in those parts where there are plenty of sebaceous gland. Such sites are the scalp, face, scrotum. There is no sebaceous gland in the palm or sole, so sebaceous cyst is never seen in this area. Scalp, face, neck, and back are the common sites of sebaceous cyst. These are the pictures of sebaceous cyst. Clinical examination, inspection. Number is also important as multiple cysts are characteristically seen in sebaceous cyst. Smooth surface and regular margin are characteristic feature of cyst. So we should inspect site, size, shape, and surface of cyst. Palpation reveals smooth spherical surface with regular margin. Temperature and tenderness both present when inflammation is there. Mobility should check in both horizontal as well as vertical direction. Swelling will be mobile in nature. Consistency: if the swelling is cystic in nature, then definitely you have to do more tests: fluctuation test and trans-illumination test. Few cysts are not translucent as they do not contain clear fluid and contain pultaceous material or blood. Dermoid cyst and sebaceous cyst. So trans-illumination test is almost always negative. Punctum: it is one where the duct is blocked completely, that form punctum. The material which usually blocking is the keratin, so it is black in color and will present anywhere in cyst. We don't get punctum in all cases of sebaceous cyst. If punctum is there, then we can definitely tell confirm diagnosis of sebaceous cyst. Often diagnose a sebaceous cyst after a simple physical examination. If your cyst is atypical, should do additional tests to rule out possible cancer. You may also need this test if you wish to have the cyst surgically removed. Common tests used for sebaceous cyst include CT scan, which help to spot atypical characteristic and find the best route for surgery, ultrasound, which identify the content of the cyst, punch biopsy, which involve removal of small amount of tissue from the cyst to be examined in a laboratory for sign of cancer. Treatment. Total excision of the cyst is the treatment of choice. Excision of sebaceous cyst is common procedure carried out in plastic and general surgical department and in general practice. The cyst should be excised completely in order to avoid recurrence. If the cyst rupture during the procedure, there is an increased infection risk and recurrence rates are higher. Laser with punch biopsy excision. This uses a laser to make a small hole to drain the cyst of its content. The outer wall of cyst are removed after a month later. This is the surgical procedure of removal of cyst, means excision of cyst. Elliptical incision is taken and then final suture line is shown. This is performed in local anesthesia. After your cyst is removed, should take an antibiotic ointment to prevent infection and should use this until the healing process is complete. Use a scar cream to reduce the appearance of any surgical scar. In case of infection, antibiotics need before and after surgery and surgical treatment. Incision and drainage should done. Scrotum sebaceous, if it is bilateral and multiple scattered, then bilateral scrotectomy should done followed by implantation of testes. Enucleation. Facial sebaceous cyst enucleated by creating minimal elliptical incision through a keratin filled orifice. Complications of sebaceous cyst: infection, ulceration, sebaceous horn, calcification and malignancy. Thank you.